Hello, good afternoon, good morning, or good evening, depending on where you are tuning in from around the world. I'm really excited to bring you this panel today on what is an increasingly important topic in the world of healthcare and the world beyond healthcare as well. We're at a rare and unique intersection where data that has been accumulating meets the kind of computational resource to process it and to draw out effective insights from it. But of course, you know, the foundation of that is getting your organization in a place where you can become data driven and capitalize on some of those data opportunities. And so, you know, the objective couldn't be any bigger here, which is really exciting. So to take us through this topic and share their expert opinions, we have five superb guests from a variety of different healthcare organizations. I will ask them all to introduce themselves one by one, and then we'll get stuck into the topic. There is a Q&A feature, so feel free to drop your questions to our panelists as well, and we will do our best to get to them. But doing as the teacher did and going around the room as I can see it, Dana, why don't I start with you for a quick introduction?
Great, thank you. Hello, everybody. My name is Dana Bensinger. I'm an informatics nurse specialist with CTG Healthcare. I've been in healthcare consulting for the past 25 years, with my practice mostly focusing around the applied analytics of healthcare.
Fantastic, thank you, Dana. And Laura, over to you.
Thanks. I'm Laura Wilt. I'm the Chief Information Officer at Ochsner Health, based out of New Orleans, Louisiana. Very happy to be with you today.
Thank you, Laura. Christopher.
Hi, I'm Chris Hutchins. I'm the Chief Data and Analytics Officer at Northwell Health, based in Long Island in New York City. We've got about 23 hospitals and over 850 or so outpatient facilities at this point. I'm glad to join you this morning.
Thanks, Chris. And Alexi?
Hi, I'm Alexi Wright, and I'm an associate professor at Harvard Medical School and also a researcher who really focuses on improving cancer quality and care, as well as informatics. Nice to be here.
Thanks, Alexi. And last but certainly not least, Kristen.
Hi, Kristen Myers. I'm the CIO of Mount Sinai Health System, as well as the Dean of Technology for the School of Medicine. And Mount Sinai is a New York-based academic medical center, and great to be here.
Fantastic. Thank you all for joining me. As I said at the top, you know, opportunities from data are significant, but to kind of contextualize what that could mean for healthcare organizations or for, you know, the healthcare system as a whole, I'm interested to get your thoughts on, you know, what being a data-driven organization or a better data-driven organization might enable for both your organizations, but for the healthcare space in general. So maybe, Kristen, I could start with you just to outline what the opportunity could look like.
I think that being a data-driven organization means that you're making decisions, you know, based on facts. And I think that, you know, what we saw with COVID was that, you know, data was extremely important in terms of being able to know how many patients we had, you know, what units we needed to enable to receive our patients who had COVID, how many respirators and vents did we have in the organization, you know, how many employees were actually, you know, out because of COVID. And so all of those data points, you know, were utilized by our clinical command center, you know, that was run by our COO of the health system to make critical decisions, you know, on an hour-by-hour basis on how we were going to run the health system. And so, you know, that's an extreme example of, you know, where data was so important in terms of making these, you know, life-changing decisions. And I think that, you know, that's why data is so important and why we need to have the strategies and make sure that the assets are all working together in concert to be able to make the decisions for the organization.
Yeah, absolutely. And Alexi, if I could kind of pass that question on to you. One of the things that Kristen referenced there was was COVID and the situation around the pandemic and how data was used to help make good ground in that situation. And the sense that at least I get from looking at the outside in is that the crisis had enabled a lot of data-driven decision making and sharing, but there are other crises going on an existing basis in healthcare, cancer being one of them. If you're a cancer patient, that is a very real crisis. And so has the data opportunity enabled ground on that space as well?
I think absolutely is the short answer. One of the things that we learn with data is, both thinking about precision medicine, so that we can actually make sure that we're targeting the right patients with the right treatments at the right time, but also looking for uniformity in the way that we practice. We, as increasingly healthcare organizations actually merge together, we want to make sure that any uniformity is really based in evidence. So having ways that we can combine data in how we practice and look at each other's practices helps us make sure that patients are getting the best care possible. I would say it also enables us to look at the costs of care. Are we using our resources efficiently, or are we using drugs that have biosimilars that could be used more effectively? And then I think the final point is really thinking about equity. This has been a huge point around COVID. Are patients of different backgrounds getting the same treatments, or are decisions because of, internal or structural racism, being applied differently for different patients? So using the data to make sure that we both understand our practice within, apply the best treatments possible for patients, and then also make sure that treatment is applied equitably is absolutely essential.
Mm-hmm. Yeah, absolutely. That term equity it comes up increasingly now, and there's increasing focus, and certainly data is something that can help strive towards that in a very real sense. Chris, from a Northwell perspective and your own perspective, to what extent do your ambitions or visions for what data could achieve coincide with both Kristin and Alexi's, or is there anything else that you think data could enable from a healthcare perspective?
I think in general, I think what we're trying to do with data kind of is similar to what I consider like the practice of medicine. There's a constant drive to be innovative and improve the way we deliver care, improve the level of support we can provide to the community. I mean, it really takes a organizational focus on that consistent transformation, understanding there's always a better way to do things. I think even into taking some of the comments on equity, one of the challenges we face is that we know our patient, at least in a general sense, but in the communities that we serve, there are people who are not our patients. And how do we help those folks too? Because a lot of the reasons they may not be our patient could have something to do with the equity issues and what's behind those things. Mm-hmm. So increasingly we find ourselves having to invest in marketing campaigns, for example, for the vaccine rollout. It's not that we don't want to provide vaccination to the whole community. It's that we don't know who we don't know. Mm. And so in order for us to reach those folks, there's other external efforts we have to undertake, sometimes bringing in different types of data sources, or even in some instances having to acquire data sources that will enable us to understand better the community so that we know how to reach them, whether it's through a direct connection or supporting community leaders, religious leaders, et cetera, in order to reach those populations.
Yeah, it's really interesting. You referenced the vaccine rollout. It's been quite a journey from medical development and deployment to almost a supply chain and logistics thing. And now, if I'm understanding correctly, there's a big component of the communication around that and almost the marketing, which is driven by the data as well.
Yeah, absolutely. It's astounding to me, and that so much has been achieved in a short period of time. Never have I seen anything like that in my lifetime. I suspect that's true for all of us. but it has posed a lot of new challenges that we've never had to face before just because of the magnitude of it. Certainly there's been pandemics and the things in the past that have impacted society, but we're in a very different place today. We have data sources that didn't exist at that, for previous crises. So it's an unbelievable time for us and an learning opportunity for sure.
Yeah, it's the speed and that learning opportunity that I think we need to capitalize on. Dana, is that one of the opportunities you see from a data perspective and becoming data driven to be, faster, more innovative, more reactive and agile almost?
Yeah, we absolutely, I think, as pretty much everyone's saying, we didn't plan for COVID. All of a sudden it was dropped in our lap. And we were automatically put into a mode where we were on the fast track. And early on, especially those folks like in the New York area who were actually hit a little bit sooner than those of us who were further south, we were able to learn from some of the stuff that they were able to do, but we were making it up as we went along. We were treating patients at volumes that we'd never treated before, didn't have a lot of the data about those patients that we typically would have for our own patient population. So I think very early on, we were at an area or a time frame when we were kind of data poor related to the patient population that we were taking care of. And at the same time, we were learning about what treatments were working, what interventions were working, what was not working, and the amount of data that we were trying to collect around that to inform our care was significant because we didn't know what we were doing. So I think that data piece became very important, and it was a really good learning lesson for us. Hopefully we never have to go through this again, but it was a learning lesson for us how to ramp up what we need to do and what we need to be prepared for in a similar type situation. I came from the military years ago, and we had prepared for many different types of scenarios, and here's how we test and run these different scenarios and gather data and that kind of stuff. We just didn't have that same infrastructure, same plan in our community health systems as we did in the past. So absolutely, data was important to us, and we're continuing to gather it and evaluate it now.
Yeah, fantastic. And Laura, from your perspective, when you think about becoming a data-driven healthcare organization, what are your hopes for what that can mean for Oxner, but beyond as well for patients and the healthcare community as a whole?
I think everyone's given such good examples of how to use data. I think the point I'd like to underscore is really that people use data. And so I think a really important component that we all need to focus on is how do we get the right information to the right person at the right time so that whether it's a physician who's making a clinical decision and using data for evidence-based medicine, like Alexi mentioned, but when is the right time to give them that information? At what point in care can that be important? Same goes for many of the other examples that people have had. I think it's going to be very important for all of us to help educate our peers and our team members around how to use data, how to interpret data. I think a big focus around data education and data literacy is something that we're all working on. I see that in the community too. You mentioned information traveling about vaccines on social media and other things. I think it's going to be so important for us all to just increase our ability to interpret data and understand it. And one of our sort of jobs collectively is to get it to the right people at the right time.
Mm-hmm. And I guess this goes out to the panel, but you referenced the kind of the education around it and leveling up. And so is a part of this process internally thinking, is it part of a change management question?
Yeah, my perspective is absolutely change management. And then there's also a component of really education on the actual tools, where the data came from, how to use it, doing a lot of the sort of basics, but it varies by the type of data. I'm sorry, Kristen, go ahead.
Oh no, I was just going to say that, we need to empower, our physicians and nurses and, registrars, our ambulatory care administrators. And so one of the things that we're doing is, building in some of the training around how to interpret data, what are the tools available into the onboarding process for new employees, and having to go back to our existing employees and really, give them the tools and the techniques to be able to make decisions where they're at. And, I think it's a huge lift, but we have to empower them to be a data-driven organization. It can't all sit within IT in a centralized department. And, while people are waiting, months for reports to get turned around, it's not going to work like that. You have to, democratize data, quite frankly. And, I think training and change management is the way to do that.
I see a few nodding heads around the panel, so it feels like everyone agrees. Alexia, I saw you certainly agreeing with some of those points.
Yeah, I think increasingly as healthcare becomes more complex and the data available to us are more complex, we need to think about ways to make tools that help people make better decisions. So one of the things at the Dana-Farber that we've done is create a genomic tool so that we collect routinely genomic data on patients. But the question is that can't just go into a database. That needs to go to a place that can be actionable. So we've created a tool called MatchMiner where people can search for clinical trials based upon mutations. And so a clinician who wants to find a trial for a patient can type in the mutation, or conversely, people running clinical trials can search for patients with specific mutations that really drive care. And before this, it was really dependent upon making sure that every clinician in the organization was, whether physician or nurse practitioner, was keeping up with all of the genomic changes. And there's a vast array of information and new data coming out that no single person can really manage. So finding ways to make tools accessible to people at the bedside is absolutely essential to drive change in care.
And Dana, from your perspective, having been on the, on the clinical, practitioner side of things and the technical kind of solution provider side of things, I imagine this change management challenge is something that comes up. And so, nurses and physicians are incredibly busy, and I can imagine that change is difficult sometimes. And so when you're looking at importing or embedding some kind of data-driven process, how do you ensure that their workflows and their considerations are at the heart of any change to make that process as simple as possible to implement?
Yeah, I think first is to kind of step back a little bit to kind of to what we talked about previously. Was I think early on we assumed our end users couldn't interpret the data that we had. I think we underestimated our end users with our data. And I'm talking, 3 to 5 years ago, even further back, we weren't pushing the data to the point in our organizations where the people who are most able to interpret it, to use it, to put it into practice, were getting the data. So I think there's a cultural piece that we're kind of coming off right now, and we're seeing that change. I don't know if the other panelists are kind of seeing the same thing, but we're seeing that change now where we're really pushing data further down to the people who are really at the point of care. And that becomes really important when we start looking at what are the impacts that data then has on my individual practice, whether it's my nursing practice, or I'm a physician, or regardless of what my role is in the organization. What data do I have available to me to inform my practice, to improve my practice, to make my practice safer? And I think we're seeing a big change in that. So getting through that change management piece of that is a little challenging, because we still have a little bit of the kingdoms of people who want to hold on to some data in organizations and don't want to kind of release that data. So I think we're in a transition. This transition, I think, is that natural flow for us as to where we are in healthcare, and then we're going to see as we start moving our data to more accessible places, as we start serving up data in ways that others can slice it and look at it different ways. We're going to see a lot less of the change management issues, because we're able to provide our clinicians with data that they can inform their care at the point of care.
Absolutely. And we spoke at the start about some of the opportunities, and sometimes when you think about data, the opportunities can almost be utopian, but change management is a difficult process. But I can imagine there are a number of other blockers or hurdles in place. And so, I think a big part of this conversation is understanding and finding ways to overcome those hurdles. So Chris, could you maybe talk to some of the challenges that you found in becoming a more data-driven organization, and then maybe some of the takeaways as well in the lessons you've learned?
Certainly, there's always challenge when you're trying to bring analytics to a new level in an organization, whether you're really early in the maturity of your analytics programs or you're in an advanced state. There's always an evolution going on. Again, much like the practice of medicine, there's always innovation happening. There's new technologies that generate more data. There's new data types that we're having to deal with. I think keeping up with that in a large organization is quite challenging because there are so many different parts of the organization that are focused on certain aspects of the delivery of care, or could be specialties, or could even be in a technology space as well. But it's really a challenge to stay on top of that from somebody that's responsible for data and analytics, to be able to anticipate the needs of the organization, develop the right kind of skill sets within your teams to be able to support the organization. How you position your service, I think, is a really important thing. And that, for me, in my team, the success for us is enabling as many people as possible to be successful and to be able to advance their capabilities and understanding they're part of the operation, anticipating what's coming, having more data at their finger, or not necessarily more data, but having the right data in a more timely manner, and to the earlier point, at the moment that it's most important to have it. And the barriers typically are, at least in my experience, have largely been because there's these silos. There's not a kind of a center of or hub of the wheel that kind of ties things together. And I think that's part of what I'm getting at in terms of being able to focus on enabling the business to be successful in every aspect of what it does, and having them see you as a resource rather than this governance structure that's kind of trying to take control and clamp down on everything. It's really a service, and as a resource, I think that even the branding piece of it for your services makes a big difference as well, because people can resist if it's not branded properly. And so if it's positioned as a resource and a service to begin with, it's much more comfortable for people to interact and work with you and pull on you for the things that they need, but they don't need me for everything. So great core competencies in different areas of the business, that my only role is facilitating the connection to data or helping with curation. Sometimes it's even just providing some assistance getting approvals for information security or data models that they might want to use.
I definitely want to explore some of the blockers and hurdles from around the panel, but there was a question that came in, Chris, that I think was related to some of the comments you're making there from Gus. So thanks, Gus, for sending this question in. And the question is, what did you do to promote the use of data in daily decision-making processes at different levels of your organization? And how big or difficult was the shift for your organization?
Honestly, it wasn't a big job to promote it. It was more of a challenge in terms of kind of keeping things contained a bit, honestly, because as you can imagine, everyone wanted to be helpful. And I expect that's probably the case for all of our organizations. But back in the beginning, there wasn't even an ICD-10 code for COVID. So in the early days of it, the indications that we were trying to identify that are associated with it, it was a little bit fluent to begin with. But as we refined it, it became a little bit more comfortable, and where we could actually make some of the data sources available to other teams, like for research. But we had to have 2-a-day stand-ups, essentially, where we were just checking in with everyone who had any need for this data to understand where we were, and to be able to tell us what they're learning while sharing what we're learning as well. But to the earlier point, I think that Alexia was making, the data was necessary and it was critical for the command center operations. In our situation, we're having to deal with load balancing across the 23 hospitals that we have, and actually we're also doing some additional support for some other organizations in the region. By necessity, the governor had brought all the health system leaderships together to just come to an agreement that we're going to collaborate and manage our PPE supplies. We're going to coordinate as best we can to make sure that we're anticipating the needs in the different communities that we're serving, and we have capacity in those areas. So I don't think it was really even a marketing need that we had to do to the organization. There was a demand that we are trying to keep up with.
Thanks, Chris. And Kristen, maybe I could kind of pass the baton over to you, so to speak. What have been some of the hurdles or challenges that you've seen, and has maybe the marketing of it been a bigger challenge? Do your thoughts kind of resonate with what Chris was saying in terms of how you're rolling that out across the organization?
Absolutely. Actually, I think Chris made some really important points. Similar barriers at our organization. We actually took a step back in, I would say, July, August of last year, because we have so many data assets. We've got, a scientific computing, high performance computing team. We have, groups, researchers that, have their own data warehouses, as well as, our own technology infrastructures. And so we took a step back to say, we've got all these data assets, but, what are we missing? And what is missing in the organization is, the data governance and stewardship. And so, we really spent a lot of time working with all of our stakeholders to get agreement that this actually was missing in the organization, and how this would, be of value for everyone, whether it be our researchers, whether it's, our teams in finance or corporate. We did get alignment that was missing. And so we're making those investments now on data governance, on data stewardship, making sure that the quality of the data and the sources of the data are transparent to everyone via a data catalog. But, to your point around, marketing, I think that it has to be marketed as a service. And, it can't be, that this is a centralization effort and, everything is going to be within the technology department. This needs to be a service that we're providing to really complement, the work that's taking place across the health system to improve the data quality. And, I think that taking that collaborative approach is the right way to go. And that's the approach that we're taking. So we've set up actually some data governance, with our executive teams and with, some of our key researchers, and really looking at, what makes sense in terms of, some of our programs that we want to move forward. And we're looking at rubrics around, what is the return, what's the investment that we'll make, and, what is the risk of either doing it or not doing it, and, to really focus on what matters for the organization moving forward.
And how does that manifest from a practical perspective? So you talk about data governance and the tech team. Does it mean there are increasingly more folks from the clinical side within tech or data teams, for instance? And is that something that we're consistently seeing across the panel as well?
Yeah, and in fact, I actually asked our Vice President of Population Health Analytics to join the technology organization to run it for analytics. And I think that, bringing the business in and our clinicians and our researchers as part of the intake process, and focusing on what matters in the organization, and not just having it from a technology perspective, is why it's working very well today.
Yeah, fantastic. Dana, moving on to yourself, a couple of the key words that I kind of picked out there around data governance and stewardship. from a CTG perspective, what do those kind of terms mean, and how can data governance or better stewardship kind of enable the organization in a sense?
Yeah, so we often work with a lot of organizations who are just on the beginning part of setting up their data governance structure. I think, you know, it's a known fact, we all need some level of data governance. It's a hard thing to do, and I'm pretty sure that all the panelists will tell you, when you first started off in a data governance structure, it just wasn't something you put together, you got people in a room and it worked. There's a lot of steps, there's a lot of work involved in building trust in your organization, putting data governance and data stewardship high enough in the organization that it is actually effective. I've seen some organizations sometimes, you know, we have the structure there, but there's no one in that data governance point of view that reports up to or lives in the C-level of the organization. And sometimes the whole data governance stewardship piece kind of fizzles out. It becomes the person who's yelling the loudest and fighting the most for their data, and it kind of falls apart. So it really requires that C-level organization and empowerment of this team and this process to be able to put together a data governance structure and make it work. And we're seeing now, you know, a lot of smaller organizations, non-teaching facilities, same thing, are really putting a lot of effort and a lot of time because they have the same data needs. They've got the same requirements from their clinicians and from their advisory organizations. They've got to be able to produce the data, and they just don't have a clear way to do that. So our role really is to come in and help be able to start that process, to support through the process with best practices, and be able to pull together a program that sustains the data model and the data plan for the entire organization.
Yeah, fantastic. And Alexia, I imagine from a Dana-Pharma perspective, that stewardship and transparency would be a fundamental in your organization as well.
I think that's right. And I would echo some of what Kristen said in terms of making sure that it's a service model, especially in a very data-driven, sort of research-hungry institution like the Pharma, where we're trying, you know, to make great strides. You want to make sure that it doesn't feel like a secret vault where the data goes in and can't come out. And that's the only way to get buy-in from all of the stakeholders. I think another thing that we're thinking increasingly about is how do we think about data governance, not just within our institution, but in collaborations with other institutions? How do we create data systems that allow us to collaborate with other organizations and have a common terminology? Or even a common data structure, which turns out to be a whole nother level of trust. You know, sharing data between organizations.
Yeah, we're opening up a big conversation here, and this is a conversation that's also coming from Freek van Hermert. So maybe Laura, I'll pose this one to you to start, but I'm keen to get perspectives from around the panel. The question is, how do we see the situation evolving with respect to storage, central data storage in institutions and across institutions? So talking to that, I suppose, standardization or shareability, interoperability conversation.
Yeah, I think I have similar experiences to others in terms of COVID particularly, and then I'll expand to the other areas. But for COVID, I think we saw great collaboration across multiple teams, just like everyone else has mentioned, really coming together to agree on data sources, how to report out data, and sort of data stewards. So we really went through all the steps of data governance very quickly around COVID, which I think was great. We actually built a data mart that our researchers were able to use to do a lot of their research around this. And use that same data and to be able to talk about it the same with our operational teams that were using it to make real-time decisions within the organization for our researchers, and then to share with other outside entities as well, which I'd love to hear comments about, because I think one of the other questions was challenges during COVID, and I did not so much have those within our organization. I thought we came together really well as a team to do that. Some of the challenges we had around data, though, were publishing or sharing data with different institutions, whether it was federally with the FDA or the CDC or HHS or which one you're supposed to be sharing with at the time, as well as locally within our state. Some states you were able to report to the state who shared that information with the CDC, but there were other mechanisms. And one of the things that we found, I think for COVID, but I do think this translates well, and to Alexi's point, when you're trying to share data, it's just data definitions. It was the questions that were being asked were similar, but not the same. So it was include patients 18 and older for adults, and some of them it was 16 and older for adults. And so that's similar on what you're trying to ask about, but it wasn't the same. And so having to track which data definitions were being used, depending on which entities you were working with, was something that we had to come around rather quickly. And I think an area that collectively I'd like to see the health systems focus is to really help drive standardized data definitions so that we can share data across all things, not just in a pandemic, but in other areas as well.
I'd love to hear some follow-up comment from across the panel on that. This is a big conversation, so I guess opening that question up around interoperability, standardization. Does everyone have any initial thoughts on that?
Yeah, I think I look at it from a nursing perspective. As a nurse, I think one of the things that we, in the data sets that we're working with, we probably lack more standardization than other disciplines because we just have not had haven't been using data the way we really should be. We don't have a good mechanism right now for nursing interventions and patient outcomes. Our terminologies are very different within the same organization, within the same units. We have different terminology. So that, as Laura said, that data standardization, what are we going to call it? How are we going to document it? It becomes important for us to be able to then show the impact of what we do on patient outcomes so that we can be able to report on that. We'll be able to trend that. We're able to look and see, is what we're doing making a positive or negative impact on patient outcomes? We struggle with that standardization as with every discipline, but it's one of those things where I think we're making some more progress towards it, but we really need to work really hard, I think, in the future, because the tools that we have now make that data much more ubiquitous. We're able to really have our hands on much more data to help inform our practice. If that data requires a lot of interpretation, a lot of translation, it becomes less and less effective, less and less exciting for people to use. So I think the more we move towards that standardization, the better off we're going to be from the nursing side.
And Chris, I can see you kind of nodding there in the background around the standardization points. To what extent, if we're standardizing data and it's shared with third parties, to what extent are you as a organization responsible for the governance of a third party or a third party's third party? How far does your responsibility stretch?
Well, I think for any health system, that's one of the primary responsibilities we have, is to really protect that data. So if data does leave the health system, it's got to be a fully vetted process that's in place. I'll give you a real example as we're talking about standardization. I have a super fun challenge because we have a lot of legacy EMRs still in the health system that I'm having to ingest data from so that it can come into a common data model so that we can see the entire population of patients that we care for. And so standardizing that in a common model is a pretty big lift just inside of our organization. But we recently formed a data consortium with 13 other large health systems in the country, and I think that number is starting to grow as well. That's really being done in an effort for the provider sector to come together and really drive innovation in research and developing more personalized medicine, and ultimately be part of the process that typically the life sciences companies have really driven independently before, where they might come in and buy a segment of data from a health system. Typically, I mean, it's aggregate or de-identified typically. So there's no PHI risk involved there, but they'll develop interventions, products, or whatever that have far more value than what they paid for the data set. I mean, we're talking about billions of dollars in some instances. So this whole idea of coming together with other health systems and providers to really focus in on that also gives us a seat at the table to say, listen, if this is going to generate revenue, it needs to go back into research. It needs to go back into the advancement of care and ultimately benefit the patients that we're caring for. I think that's a new level of responsibility that healthcare organizations are coming to realize that they've got to step up into this space a bit and kind of take some control and be more proactive and creative in formulating the relationships that'll allow them to then, again, reinvest and to do the things that we know are important from a research and advancement of care perspective.
Yeah, it's interesting how this conversation has naturally evolved from inward-looking organizational structures to how that can interconnect with the wider healthcare organization, and how as a system, as a whole, we can use data better and more effectively. We've only got maybe 5 minutes left, so I'm keen to get final thoughts, comments, key takeaways from each of you on the panel. So maybe Laura, I could start with you, and then we'll work our way around.
I think the great part is the promise of data and how we can use it is really, we're at the tipping point, maybe you can say, in healthcare specifically. I think there's a huge opportunity ahead of us. With that comes a lot of responsibility and a lot of hard work, I think, from our collective teams, whether it's data governance, whether it's sharing, so all of those things. I'm encouraged by it. I know we have a lot of, great examples of doing simple things to use data to really provide those insights to our clinicians or to our operators at the right time, and even directly to our patients. I think that's really the key, is taking the data and turning it into an insight that someone can act on, and presenting it at the right time. So you don't want people to have to be experts in sifting through giant databases. You want to give them something that they can take an action on right then. And so it has to be relevant, it has to be right, and they have to trust it. So there's a lot that goes into that. But I'm very encouraged by all my panelists and their work as well.
Thank you, fantastic. And Chris, what are your final thoughts or key takeaways for the audience?
Definitely hearing a lot of common themes from my fellow panelists here. I think what really strikes me is that our primary customer is always a patient. And when it comes down to it, whether we're doing technical work or administrative functions, it's still all about people. And so people and relationships is probably the most critical thing that we can pay attention to as we're working through data and analytics, because the things that we deliver really should be providing value not only to our patients but also to our clinicians. Ultimately, we're seeing a propagation of data growth that's I've never seen before. I mean, we're doubling of the size of data in accumulated history on an annual basis at this point. So it behooves us as technical and analytics leaders to make sure that we're focused on how do we harness this information and get the right information liberated at the fingertips of the clinicians at the point of care. Again, back to what Laura was saying about the timing. You got to have the right information at the right time. So, that's absolutely a focus for me.
Fantastic. Thank you, Chris. Alexi.
Yeah, I would echo a lot of what others have said, except I would also say that one of the remarkable things about COVID was we saw an incredible speed of innovation. And I am hopeful that and also a collective mission-driven attempt to solve a huge, hairy problem that was killing people all over the world. And I hope that as we move forward, that we will use our data not only to address the people within our systems, but also outside with a lens towards equity.
Fantastic, thank you. And Kristen?
I think, building upon what everyone else has said also, it's really about, educating our physicians and nurses, our researchers on what tools and techniques are available to them, and really embedding it in their workflows so that, they can get those actionable insights at the point of care. And, you know, I think that's where the opportunity is, and as well as the change management aspects of, you know, how do you build the data governance and the data stewardship successfully in, you know, complex organizations where, you know, you know, all of the rich data assets may live outside of a centralized approach. And I think having that collaboration is tremendously important.
Yeah, fantastic. And final comments from Dana.
Yeah, I agree with all the panelists. I think this is an exciting time. I think, as Lexi said, the innovation, we're moving at lightning speed. I'm old enough to remember, you know, data and analytics to me was a stack of green bar paper in my desk when I came into my office in the morning. And to see where we've gone and what we can do since then is tremendous. One of the areas that I have a particular interest in and a concern in is that patient-entered data. I think there's an area where we need to engage our patients more in providing their own data to us, and that opens up a whole new can of worms. I think our patient population is anxious to do that. There's a lot of value to be gained from that, but it also opens up a whole analytics can of worms as well, and a standardization can of worms and things. So I think we're right in the cusp of that. There's some people doing some really great things with that, and I think that's the next exciting thing I see really coming in the near future, is being able to then really make that patient that real partner with their data as well.
Yeah, I think this is such an exciting time to be having this conversation. You know, to your point, Alexi, you know, around being mission driven. You know, we're very grateful, you know, to use our platform at Reuters to be able to have these conversations, invite folks like yourselves on to, you know, push forward this mission. So as an industry, we can deliver ultimately better healthcare, you know, with better access, cost, and equity. And so we've probably just scratched the surface of this conversation today, and no doubt it's one of those conversations that we could speak all day on. But for myself and the team, thank you to you all for, you know, being so open with your time and your thoughts. To Dana and the team at CTG, thank you for helping us put this panel on, and for your sponsorship of it. And for everybody listening in, thank you for being so engaged and asking questions of the folks here. For everybody, we will follow up with an email so you can get the recordings. But for now, that is over and out, and thank you again.
Thank you.
Thank you.
Thank you.